Living with a missing tooth affects how you chew, how you speak, and how confident you feel walking into a room. To fix it permanently, you need an artificial root anchored directly into your jawbone. But when looking for a provider, you encounter significant price variations across Muscat's dental clinics. You look online and see budget clinics advertising deep discounts, right next to premium specialists quoting nearly 1,000 Omani Rials for a single tooth. That massive price gap exists because of a specific marketing tactic. Budget clinics often quote the surgical root insertion to get you in the door, leaving out the cost of the visible tooth itself. To give you a clear picture of the investment, we gathered the actual 2026 data for dental implants across Muscat. We break down the exact procedures, detail the mandatory diagnostic fees, and give you a strict checklist for vetting your clinic. Knowing how the multi-stage cost of an implant is actually calculated is the only reliable way to avoid bill shock and secure a safe medical outcome. This chart breaks down the implant's 3 parts. The foundation titanium root costs 250 to 450 OMR. The abutment connector adds 50 to 100 OMR. The custom crown adds 150 to 300 OMR. Altogether, a full single-tooth restoration averages 470 to 900 OMR. But your final bill will include necessary fees that exist entirely outside of that 3-part physical structure. Standard 2D X-rays do not give a surgeon enough detail to safely perform this operation. You need a 3D CBCT scan to precisely map facial nerves and bone density. This mandatory scan adds an unavoidable 30 to 70 OMR cost. Your initial specialist consultation and any necessary tooth extractions prior to surgery are billed separately and rarely included in flat-rate packages. So when you see a low advertised quote, realize you are likely only buying the foundation. You have to budget for the entire structure and the required diagnostics to actually get a working tooth. Even with those baselines established, 2 patients walking into the exact same clinic can pay drastically different totals. This matrix maps out the material choices. Titanium is the standard baseline, highly durable with a 95% success rate, but risks a dark metallic gum line. The zirconia upgrade costs 20% more, but is completely metal-free and delivers brilliant aesthetics for front teeth. The second major cost variable is a biology tax. You pay this tax if you delay your treatment. If a tooth is missing too long, your body begins bone resorption. The jawbone physically shrinks away from the empty socket over time. If your jawbone shrinks too much, a surgeon cannot safely anchor an implant. You will need a preparatory surgery called bone grafting to rebuild the foundation. Bone grafting adds 100 to 300 OMR to your final bill, and it extends your overall healing timeline by several months. Ultimately, your final invoice depends heavily on your personal aesthetic demands and how long you let your jaw sit empty. If you suffer from severe multi-tooth loss, attempting to replace those teeth one by one is going to be financially disastrous. This schematic shows how an advanced reconstructive procedure called All-on-4 solves that problem. By anchoring an entire row of teeth onto just 4 strategically placed posts, the procedure costs between 2,500 and 4,500 OMR per arch. That is cheaper than paying for a dozen individual implants. The main barrier to paying for any of these procedures is that Omani health insurance providers aggressively categorize implants as cosmetic, and they will likely deny your coverage. The most practical workaround is to use top-tier clinics that partner with local banks. These clinics offer 0% interest installment plans spread over 6 to 12 months. By utilizing strategic monthly financing, even complex reconstructive surgeries become financially accessible without relying on unhelpful insurance policies. You have the budget sorted out. Now you need to choose a safe, high-quality clinic within the Muscat capital area. Keep in mind that looking at reputable clinics in suburbs like Al Seeb can often yield better package rates due to lower overhead costs, while maintaining the exact same surgical quality. Before you agree to any procedure, run your consultation through this 4-point vetting checklist. First, verify your surgeon's qualifications. You want a registered prosthodontist or a periodontist, not a general dentist who took a weekend seminar on implants. Second, demand a total written quote that explicitly includes the crown. Third, confirm they use elite medically certified implant brands. Fourth, ensure the clinic operates modern 3D CBCT scanning equipment on site so they can guarantee your surgical safety. True affordability is never found in the lowest advertised sticker price. It comes from securing premium materials and specialized expertise, backed by transparent pricing and smart financing.